This presentation is over atrioventricular septal defect. After watching this presentation, you will be able to understand more about what atrioventricular septal defect, or AVSD, is and how it is acquired. You will also be able to understand how the blood flow is different from that of a normal heart. You will also know the signs and symptoms of what an infant born with AVSD will present with, and also understand the treatments and outcomes expected for an infant with this defect. According to the Centers for Disease Control, CDC, an atrioventricular septal defect is a heart defect in which there are holes between the chambers of the right and left sides of the heart, and the valves that control the flow of blood between these chambers may not be formed correctly. This, in layman's terms, means that blood goes where it should not be going within the heart. A complete AVSD means there is a hole that connects all four chambers of the heart. The abnormal hole that connects all four chambers of the heart causes deoxygenated and oxygenated blood to mix throughout the heart. This mixing of deoxygenated and oxygenated blood causes a larger than normal amount of blood to get pushed into the lungs. This causing the lungs and heart to work harder than they would normally have to work. This increased workload can lead to congested heart failure in the infant. According to the CDC, 1 in 2,120 babies are born with this defect. Being born with this condition would mean that it is congenital. In most infants with this defect, the cause is unknown or idiopathic. In some cases of infants born with this defect, the disease is due to genetics or chromosomal defect. This heart defect is common in infants with chromosomal abnormalities such as trisomy 21. Trisomy 21 is also known as Down syndrome. AVSD is also thought to be caused from things the mother encounters while pregnant, such as contaminated food, water, or the use of certain medications. There are diagnostic tests that are used to discover if the baby is affected by the defect while in utero. An ultrasound of the baby's heart can be performed if a defect is suspected. A fetal echocardiogram can also be obtained. A fetal echocardiogram takes an ultrasound of the blood flow of the heart to determine if there are any defects in the development of the heart. Once a newborn with AVSD is delivered, the signs and symptoms of the defect can be detected. After delivery, the OB nurses will notice breathing problems, weak pulse, bluish coloring of the skin, poor feeding, slow weight gain, and swelling in the legs and belly. Infants will have breathing problems because of the excess fluid being pushed through the lungs. The weak pulse is due to the lack of blood flow throughout the body. Mixing of deoxygenated and oxygenated blood causes a lack of oxygen to the body tissues. This creates a bluish discoloration of the body. This also causes poor feeding because it is hard for the baby to breathe while feeding. Poor feeding also exacerbates slow weight gain. Swelling is caused from the excess fluid being pushed through around the body. Progression of AVSD is controlled by symptom management, medications, and surgical intervention. Symptom management for heart failure with medications such as diuretics, digoxin, and ACE inhibitors before surgery. All these medications decrease the workload of the heart and lungs. Patients will receive antihypertensive medication if hypertension is present, antibiotics to prevent infection from surgery, and a good nutrition plan to help increase calories to help with proper weight gain. The only permanent way to fix this defect is by surgical intervention. During surgery, surgeons will close the abnormal hole and repair the walls of the heart. This surgery will allow blood flow to take its normal path throughout the heart. Without surgical intervention, the baby would not be able to sustain life due to the blood mixing in the heart. Expected outcomes for a baby after surgery include that the vital signs are within normal range for age, skin is pink and warm to the touch, strong and equal peripheral pulses, normal capillary refill time, absence of distended neck veins, normal sinus rhythm, absence of edema, adequate urine output, successful feedings, and age-appropriate weight gain. These outcomes are findings of a normal, healthy baby to have. After surgery to fix the defect, baby should have a normal functioning heart. Following surgery, the nurse is going to have to complete multiple assessments on him or her. These assessments include a cardiovascular, respiratory, and hydration assessment. With a cardiovascular assessment, nurses are listening to the heart for murmurs. Cardiovascular assessments also include checking the pulses and capillary refills, making sure the blood is circulating the body properly. Assessing for edema to make sure there is no pooling for fluid in the legs and belly. Edema means that the heart is not pumping correctly. During a respiratory assessment, nurses are listening to lung sounds, making sure that there is no collection of fluid in the lungs. Nurses are also looking at respiratory effort. If there is excess fluid in the lungs, the baby needs to breathe harder and faster to get proper oxygenation. For a hydration status assessment, the nurse will assess skin turgor to make sure the baby is staying hydrated. Being well hydrated will help the baby's vital signs stay within normal limits. An acceptable nursing diagnosis would be decreased cardiac output related to decreased myocardial function as manifested by difficulty breathing, bluish discoloration, and edema. Interventions can include the following. Monitor circulation by checking pulses and capillary refill. Poor perfusion is evidenced by decreased or absent pulses, slow capillary refill, and a bluish discoloration of the skin. Clump nursing interventions together to allow baby time to rest. Allowing time to rest helps the heart rest and decreases cardiac workload. Keep baby in a thermal-regulated room. This helps the baby stay at a neutral temperature. If baby gets too hot or cold, this can put extra stress on the heart and lungs, causing them to work harder. Parents need some education to watch for symptoms related to decreased cardiac output. Educate on medication as well as signs and symptoms of infection after surgery. Signs to look for in decreased cardiac output include cyanosis, difficulty breathing, nasal flaring, retractions, and edema. Medication education includes name and purpose, medication administration instructions such as what foods to avoid, side effects, and when to report side effects to the provider. Some signs of infection to look for after surgery include increased temperature, redness, swelling at the surgical site. Infection symptoms include drainage from surgical site that is yellow and may have a foul odor. In conclusion, the viewer now understands what AVSD is. They also know what the signs and symptoms of AVSD present with. They also have a knowledge of how AVSD is treated both medically and surgically. They now understand what is suspected before and after surgery. And they also know some of the education provided to the parents with infants who have AVSD. And NCLEX question number 1. The nurse knows that it is best to take care of an infant born with atrioventricular septal defect. How? Limiting stimuli and clustering cares. Allowing family and friends of the family to visit throughout the day. Keep the room at a cooler temperature. Keeping the infant in a room that is well lit. And the answer is limiting stimuli and clustering cares. And we do not want the infant to become upset, which would lead to the heart working faster and harder, which causes more problems for the infant. Question 2. An infant was just diagnosed with atrioventricular septal defect. The nurse knows that infant will need to be prepared for what intervention? This defect will only need to be managed with diuretics and ACE inhibitors. Infant will be able to leave the hospital with the parents after teaching is done. The only way to fix this defect is surgical intervention. There is no intervention for this defect. And the answer is the only way to fix this defect is by surgical intervention. The hole needs to be surgically closed to prevent the blood from mixing. Here are a few of our references.